Hi everyone. Today I wanted to go over my bread and butter, which is rheumatoid arthritis. It's such a big topic. I'm going to try to go over some of the high points. And if you have further questions, just message me. And I also did write a list of questions that had been asked over DM. So rheumatoid arthritis is a chronic inflammatory arthritis. So it typically to be diagnosed lasts more than 6 weeks, where you're having swelling for more than 6 weeks in your joints. The joints that are most commonly affected in a patient who has rheumatoid is what we call the MCP joints. So it's the metacarpal phalangeal joints, these two, the second and third, both sides. So what's key is that it's a symmetric arthritis. So it affects classically the second and third joints on both hands, occasionally these joints, the proximal interphalangeal joints, and then the wrists. So those are the most common joints that are affected, and typically it is symmetric. That's key. Another criteria is morning stiffness is a huge one. We usually see morning stiffness that lasts 30 minutes to an hour. More than an hour is very classic. There's that stiffness that feels better with movement. Once you start getting the joints going, you start feeling much better and that you're able to do your day-to-day activities. That's in contrast to osteoarthritis, which is our wear and tear arthritis, where actually you feel best when you're not moving and you get worse as the day goes on. So that's a contrasting point between those two different types of arthritis. Other big things that we look for in a rheumatoid arthritis is, yes, it can start moving to larger joints, shoulders, knees, elbows, but it's more rare and it's typically in more aggressive disease. So that's something to keep in mind, that it usually starts out classically more in the small joints. And we do look for certain lab factors. So big ones are the rheumatoid factor, and then the CCP is another one. Both of those are very useful tests for rheumatoid arthritis. And then we also are looking for inflammation because, as I mentioned earlier, it's an inflammatory arthritis. So we usually will see an elevated ESR and CRP, both of which are inflammatory markers that we look at. X-rays are important to monitor the progression of the disease, and you can start seeing erosions if it goes untreated for some time. So that's another thing. So we do get the questions, certain questions that I get are, how do you get rheumatoid arthritis? And as much as it's been studied, it's not 100% clear. There's definitely a genetic component to rheumatoid arthritis, but there's also environmental factors. So tobacco use, so people who smoke, that can kind of overactivate your immune system in an immune system that's already active. Other things is our gut microbiome can play a part, and that's being studied right now too. And then, so that's more bacterial related. Other things can be viruses. Could there be a relationship with parvovirus or with EBV? So those are other considerations, and things that are looked at, but there is a strong genetic component as well. Rheumatoid arthritis typically occurs in younger, can start in your 40s. It can start in juvenile cases as well when you're much younger. So, there are kids who can get arthritis, but typically 40 to 60. And then it's 2 to 3 times more likely in women than in men. So that's another thing to keep in mind with rheumatoid arthritis. And other things that we look at are extra articular manifestations. So what that means is, besides the joints, what else can be affected from rheumatoid? Well, you'd be surprised, but in long-standing disease, there are many other areas that can be affected. You can get eye inflammatory disease such as scleritis or episcleritis. You can get skin conditions. Some patients get what we call vasculitic lesions. So leukocytoclastic vasculitis is one of them that we see. About 20% of rheumatoid patients can have Sjogren's overlap, which is a dry eyes and dry mouth condition. And also there can be inflammation in the heart and sometimes in the lungs related to rheumatoid. So those are all other manifestations that can occur with rheumatoid arthritis. I hope you found this video helpful. I didn't touch on treatment strategies. There are so many treatment strategies out there right now. We use disease-modifying drugs and TNF inhibitors, as well as other classes of drugs, and I'll try to do another video on that, but comment below with any of your questions. Hope this helps.